1. A CNA instructor is preparing a lesson for adult learners in a hybrid end-of-life doula program. Which instructional strategy best aligns with Knoll's principles of adult learning? A. Requiring memorization of textbook chapters. B. Using hypothetical case studies to encourage discussion. C. Assigning worksheets without contextual examples. D. Providing extended lectures without breaks. 2. During clinical supervision, a student consistently demonstrates a lack of empathy with patients. What is the instructor's best response? A. Remove the student from the clinical rotation. B. Submit a failing grade without discussion. C. Schedule a one-on-one meeting to provide formative feedback and a remediation plan. D. Instruct another student to model behavior without involving the original student. 3. In planning a hybrid training curriculum for hospice care, which component is most critical for ensuring instructional alignment? A. Number of modules delivered online. B. Visual design of presentation slides. C. Measurable learning objectives linked to competencies. D. Amount of time allocated to written exams. 4. Which of the following best demonstrates compliance with regulatory guidelines in a train-the-trainer program? A. Allowing experienced CNAs to begin teaching without certification. B. Maintaining detailed records of course syllabi, instructor credentials, and evaluation tools. C. Relying solely on word of mouth to verify student performance. D. Using unlicensed preceptors in clinical settings. 5. A CNA instructor is assessing student performance in a hospice clinical. Which method provides the most valid and reliable evaluation? A. Peer assessments alone. B. Unstructured personal observations. C. Direct observation using a standardized clinical checklist. D. Self-assessment without instructor input. 6. An adult learner in your training expresses resistance to online modules. According to adult learning theory, what should the instructor do? A. Remove the learner from the hybrid program. B. Emphasize the importance of following the rules. C. Explore the learner's preferred learning style and adjust where feasible. D. Require the learner to complete the modules as assigned without accommodations. 7. Which is the most effective way for a CNA instructor to deliver feedback after a clinical skills check? A. Publicly correcting the student in front of peers. B. Delivering vague encouragement regardless of performance. C. Providing immediate, specific, and private feedback focused on observable behavior. D. Waiting until the end of the week to discuss any concerns. 8. A student is underperforming in hospice-related role-play scenarios. What is the instructor's most appropriate mentoring approach? A. Ignore the issue until final evaluations. B. Assign disciplinary action immediately. C. Offer targeted coaching and reflective practice sessions. D. Delegate the problem to another instructor. 9. Which activity best supports curriculum development for a CNA hybrid end-of-life doula course? A. Designing the syllabus based only on the instructor's past experience. B. Developing objectives based on student preferences. C. Aligning course objectives with certification competencies and scope of practice. D. Avoiding updates to previously used materials. 10. How should a CNA instructor maintain legal documentation related to student training? A. Shred all records after graduation. B. Maintain accurate attendance, evaluations, and clinical logs in a secure format for the required retention period. C. Only keep the final exam scores. D. Store records in a personal cloud account for convenience. 11. During a clinical instruction session, a student questions a palliative care protocol. How should the instructor respond? A. Dismiss the question to maintain authority. B. Encourage inquiry, reference current best practices, and provide resources. C. Instruct the student not to question clinical standards. D. Tell the student to research it on their own. 12. What is a critical ethical responsibility of the CNA instructor in a train-the-trainer role? A. Withholding information to test students' initiative. B. Teaching personal beliefs about end-of-life care. C. Ensuring equitable access to learning resources and evaluations. D. Encouraging favoritism for high-performing students. 13. In developing an online hospice module, how can an instructor apply effective adult learning principles? A. Use passive video lectures without assessments. B. Incorporate real-life scenarios and self-reflective journaling. C. Avoid learner input to reduce complexity. D. Require textbook reading only. 14. A CNA instructor wants to assess a student's critical thinking in a hospice setting. Which tool is most appropriate? A. Multiple choice quizzes. B. Time logs. C. Simulation-based scenario with reflective debriefing. D. Uniform policy checklist. 15. What should be the primary consideration when assigning a clinical site for doula training? A. Proximity to the training center. B. Site familiarity by the instructor. C. Alignment with clinical competencies and supervision standards. D. Size of the facility. 16. A CNA instructor is required to evaluate learning outcomes. Which method aligns with best practices? A. Rely only on course completion rates. B. Use anecdotal reports from students. C. Collect and analyze data from multiple assessments and evaluations. D. Only assess the final exam results. 17. Which approach is most effective for mentoring new CNA instructors? A. Formal orientation with ongoing peer coaching and feedback. B. Handing them a syllabus without further support. C. Letting them learn on the job. D. Avoiding evaluations during their first year. End-of-life doula CNA hybrid. The End-of-Life Doula CNA Hybrid Holistic Hospice Training Plus Certification Test is a specialized certification exam designed to assess the knowledge and skills of certified nursing assistant CNAs who seek advanced training in end-of-life care. This hybrid program blends clinical instruction with holistic, patient-centered approaches, focusing on emotional, spiritual, and physical support for individuals in the final stages of life. The exam evaluates competencies in adult learning principles, clinical supervision, communication, curriculum planning, ethical care, and regulatory compliance. Candidates are tested on their ability to provide compassionate hospice care, educate others, and uphold professional standards in both in-person and virtual environments. Here are the top 5 beneficial uses of the sample exam. 1. Enhanced patient care. The certification equips CNAs with holistic, empathetic, and culturally sensitive skills to provide physical, emotional, and spiritual support to patients at the end of life. 2. Career advancement. It distinguishes CNAs in the healthcare field, opening doors to specialized hospice roles and leadership positions in palliative care teams. 3. Improved communication skills. Trainees learn how to facilitate difficult conversations with patients, families, and interdisciplinary teams, ensuring clarity, compassion, and ethical decision-making. For regulatory and ethical preparedness, the program emphasizes compliance with legal, ethical, and documentation standards required in hospice care environments. 5. Educational and mentorship roles. Certified individuals gain instructional skills that allow them to mentor peers, deliver training, and contribute to community-based end-of-life education.